Welcome to The Point of View. This is your favorite current affairs show on television. Here on The Point of View, we get the right guests. We ask them relevant questions on issues that matter to you. It's an interactive show. That means we want to hear from you. If you're watching on television, you can send your questions or comments to the number on the screen. If you're watching on any of our social media platforms, feel free to comment on the stream. And it's been 9 weeks since the first COVID-19 case was registered in Ghana. It's been 9 weeks of lots of conversations about number of cases, those who are mild, those who are asymptomatic, those who are moderate, those who are severe, and unfortunately those who have passed. There's also been conversations about treatment, it's conversations about care centers, sampling and all of that. Tonight on the show, we're going to hear stories from some very brave, recovered COVID-19 patients who want to tell their story. Tell us what mild actually means, what severe means. We also speak to a doctor and a nurse who've been treating COVID-19 cases for over 2 months. It's a very interesting panel I have joining me from different parts of the country. We'll be right back with that. Stay with me. So welcome back to the show. So tonight we're very blessed to have 2 recovered COVID-19 patients who want to share their story with us live. We also have a doctor who's been at the forefront of one of Ghana's leading treatment centers, joining us to tell us more about the work they've been doing to help our COVID-19 patients recover. There's also a nurse who's been at the front line. He's been blogging and nursing throughout the period, and he'll join me to talk about what we've been doing. But let me just remind you of one of the happy moments we experienced in Ghana a couple of weeks ago when all 7 patients at Kolebu Treatment Center were asked to go home after full recovery. One of my guests for tonight took a short video, which I want to share with us before we talk to our guests. All right, so that was a brief video taken by Kobe Blake. Kobe is I like to call him a citizen journalist, but it's actually a nurse and a health blogger. He's one of my nurses who's joining me tonight. Kobe, great to have you on The Point of View. Good evening.
Good to be here, Bernard.
Wow, I like your mustache. I also have a medical practitioner, a recovered COVID-19 patient who is now doing a lot of work in dealing with COVID-19 stigma, Dr. Jillian Buji. Doc, good evening.
Good evening.
Great to have you. Thank you so much for sharing your story. I have also
nice for her.
Great. I have another COVID-19 or former COVID-19 patient who wants to share a story with us. It's called James. Hello, James.
Hi, Bernard. How are you doing? Good evening.
It's great to have you. Thank you so much for sharing your story. And I also have a member of the National COVID-19 Case Management Team who's an infectious disease specialist at Ghana East Hospital in the person of Dr. Joseph Oliver Comey. Dr. Comey, good evening.
Good evening.
Great to have you. So let me start with Dr. Jillian Buji, because it's quite interesting that you are a doctor, but you're also a recovered COVID-19 patient. Can you tell us quickly your story? What's your COVID-19 story in a nutshell?
Okay, thank you once again. And then I would want to say a very good evening. It goes like this. I actually came into contact with a by then suspected COVID-19 patient on the ward. That was on the 29th of March 2000. Then on the 30th, I was very fine going about.
Wow. Hello? Okay, we seem to be having a challenge with Dr. Buji. I will bring back shortly. Let me go to James whilst we restore connection with Doc. James, so what's your COVID-19 story then?
Bernard, my story. So the Thursday, I think it was a Thursday that they announced the first couple of cases. That was on the 13th of March. I was out on a Friday evening, a couple of different places I went to in town. By Monday, I had a bit of a cough, a slight cough. I'm not somebody who tends to have coughs. And with all the news around, I was cracking jokes here and there. But by the evening, I was also feeling some aches. So I figured, you know what, let me call the line. What do you call the line again? The COVID line, basically. So I gave them a shout. Symptoms progressed a bit. By Monday night, I was having a terrible fever, bad headache, and that continued all through to Tuesday. That was when I pushed the team and I told them, look, this is not something that is very typical. And I imagined it could be malaria, but I told myself, even if it's malaria, it's the sort of malaria that I need to confirm and act on as quickly as possible. So they came, they tested, and they confirmed on Thursday that it was actually COVID. By that time, the symptoms had subsided a little bit, but in a nutshell, I would describe it as a very bad flu or pretty bad malaria. For me, the worst symptoms were headache, bad fever, and fatigue, which lasted for a while, which lasted for a few days. But that's how I would describe the first couple of days of it.
Headache, bad fever, and possibly malaria-like symptoms. How many days did that last?
Well, the intense fever was about 4 days. So 5 days, from Monday to about Saturday,
wow.
It was ongoing, getting a little better. Chills were there, ups and downs of it. By Thursday, it had eased off a bit, but I was feeling weak. The headaches were still there. The aches were still there, but it was improving. Cough was not too serious. And fortunately for me, I think I was lucky because I didn't have any breathing issues. That was my saving grace. So the rest of it was really just recovering from the fatigue over the course of the next few days after that Saturday. So from Monday to Saturday, had all the symptoms: fever, fatigue, headache. And then by Saturday, the fever had broken. I was still sweating through the nights though. And
wow.
Dr. Kome was checking on me quite regularly. And he just mentioned to me that, it would take some time. The sweat is basically getting the toxins out of your system. So it was about 10 days, I think about 9 or 10 days of symptoms. After that, things sort of eased up a little bit.
So at what point did you test? Was it so by the time you had tested, did you still have symptoms, or just walk me through the testing thing and when you sort of got to know you were positive? Okay,
so Monday when I had the light cough, I gave them a call. The symptoms weren't really that many, so they were waiting for another follow-up. They said if it progressed, I gave them another call. So on Tuesday, I called. I told them, look, I've had a horrible Monday night. This is the situation. I need to go to the hospital to go and check for malaria, because if it's malaria, I need to act on it. So they came in on Wednesday, took the test, and Thursday, I got a call from Dr. Kome. I had a feeling, I don't know why I had this feeling that it might be that. And Dr. Kome just kept me calm. He told me, he cracked a little joke and he told me, you know what, so you are positive for COVID, nothing to stress about. In a sense, you should keep calm. And then I gave them a list of those who I had been in contact with that weekend. And I think that was probably one of the worst parts of it, because, I had seen up to 20, 30 people. No. I had to give the names, and I had to call those people myself to let them know ahead so they don't panic. So you call them and you let them know. That's the responsibility. You call them, you let them know this is the situation. But fortunately, nobody got it. All the people were tested and they all came out negative.
Wow.
So that was the process for me getting tested. Yeah.
That's interesting. Let me come back to Doc. James, I'll come back to you. Thank you for sharing. Dr. Jillian, I believe I have you back on a hopefully better connection. You had just started your story when you went off. So just walk me through again your COVID story.
Okay. So on the 31st, I woke up with severe bodily pains. I had fever, then I had chills. So just like I earlier on said, I inserted a suppository Trimol, and then I was hoping to get better during the day. But still, my symptoms progressed. I felt really, really feverish, and then I wasn't having a thermometer with me by then. So just then my boss calls to find out how I was doing, because he usually calls to check on me, not because I wasn't well, but he just calls to check on me, especially when he doesn't see me. So when he called, I told him that I was having these symptoms, and then I told him that he actually promised that he would come the following day to come and then see me. So on the first, I had dry cough. And then this time around, I had access to a thermometer, so I took my temperature, and then I recorded 40.4 degrees Celsius.
Wow.
So again, I called my boss, and I told my boss that this was the problem, and that I had started coughing as well. So he actually did come to me. He came with IV mol and some antibiotics, IVs, and then it was administered on me. And then I felt a bit, he sat down to chat, and then he left. On the second, the symptoms increased. This time around, I had headaches. So,
Oh, gosh. Okay, we still have a challenge. Oh, Lord, such a great story. We seem to be having a challenge with the connection. We will certainly work and bring her back. So, okay, Dr. Comey, let me try you briefly before I come back to James. So far, James has narrated what happened to him. Is that your own recollection of the parts that relate to you? Because apparently you called him at some point, cracked the joke, and then sort of made things easy. Is that what happened, Dr. Oliver Comey?
Well, exactly what happened. You know, when you are given the responsibility of breaking sometimes what I call bad news to people, you need to develop the art of breaking bad news. So this was 19 new just about the third or so day in Ghana, and here I was having to call people and tell them, I'm sorry, your test results came back positive. So you need to develop the art. So I cracked some jokes, and I got James to actually buy into it. Yeah.
So it's one of your first patients, and so it wasn't as if you were quite skilled at the time dealing with COVID-19 patients. This was one of the first few patients, right?
Yeah, you know, I do a lot of infectious diseases, and infectious disease is always bad news. So over time, we developed this art of breaking bad news to people. So at least I can say I was a little skilled at developing, discharging that duty.
Okay, so it appears to me that James was one of the milder cases in that sort of continuum of asymptomatic to ICU. Where do you position James in his COVID story?
So James will say was mild.
Mild.
Because James had symptoms. James had cough. James had high-grade fevers, especially at night. And he had a muscle ache. So James was mild, in our opinion. Yeah.
Hey, so high-grade cough, muscle ache is mild. Then the moderate is wild, pound, and then severe, we are dead. I mean, how is that mild? James, are you there? James. Where has James gone to? I want to ask him.
Hi, I'm with you.
He's saying that you had high-grade fevers, you had muscle pain, and you had difficult nights, and he's saying that's mild. I mean, is this serious?
I mean, apparently, right? So, but yeah, it's rough. It's rough. Like I said, it feels like bad malaria. It's a notch above the typical malaria you would have here. Those fevers that are a little bit manageable. This is it feels intense enough that you want to get checked. You want to find out that, okay, if this is malaria, do I need to get a jab this time around, or can regular medications work? So it is a notch above the standard malaria, I would say.
Wow. And yet he describes you as mild. Okay.
As mild.
Good. I'll go back to Dr. Jillian as soon as I have her, because I wanted her to finish the first part of her story. Then I'll come back to you, and then. But let me just try Kobe. So Kobe, you, whilst you are nursing people at Kolebu, you have the presence of mind to also do some health journalism and blogging. Just quickly talk me through the first video we saw, the group of cars and going out and doctors and nurses clapping. What was that about, and when did that happen?
So the story, when you study the terrain about how people receive the story of COVID and the worry about whether people are recovering and whether people will even survive COVID, it informs that sometimes you have to share the good news story. So the team at Kolebu actually haven't monitored and provided the adequate case management. On one of the days, received results of the test that involved the patients that were undergoing treatment. And we were still in doubt what the outcomes was going to be. And because they were our first set of patients we had actually admitted. So were we going to fail? Were we going to tread the path of where Kolebu is often in the media for the bad reason? So I told myself that then obviously we need to put this down. However it goes, well, we will celebrate it in our own way. So I had the engagement with the PR, engagement with the public health unit, and my team to actually let them know that I'm going to be equally documenting whatever is going to happen. And lo and behold, the results came that day. I think it was in the night.
Wow.
And some of us were on night duty, and our leader had to break the news on our group that this was the results. I mean, some who were already sleeping couldn't sleep the whole night. And so it was the first results. We're very excited. Then we had to wait for the second result to come. Their samples were taken, and then we waited patiently. We said, what happens if one test positive and the other still tests negative? We said, okay, we still have to keep hopes alive. Then the last results came. Everywhere was massive. Everybody was celebrating, and there was no reason for me to have left the camera than to film what was happening, so that we could look back at it. And
so Kobe, all the 7 that you had tested 2 consecutive negatives. Were they all on the same spectrum of mild, moderate, severe, or these were all asymptomatic? What was their? How do you describe the level of their COVID sickness?
From case management, obviously they were all mild cases, and most of them, I think, except one, had full-blown symptoms, and the others were asymptomatic. They were not showing symptoms per se, but occasionally you had a few reports of maybe I feel this way, I feel a bit feverish overnight, I have some itch, but they were mild. They could last for a few hours, and that was it. But we had one who had actually gone through the process of even going to the ICU and coming back, yes, with some severe symptoms. But all of them came out negative on 2 counts.
Wow.
And it was an absolute cause for celebration.
I mean, what was heartwarming for me was to see doctors and nurses so happy that their patients are okay. I don't think we see that enough. A lot of the press talks about nurses who don't care, doctors and nurses who are always going on strike. So to see doctors and nurses so happy that their patients are better, that was such a refreshing and different aspect of the practice. I mean, clearly we don't know you guys that well, because we think all you guys are looking for is money. But clearly you are doing this for something deeper than money, isn't it?
To date, everybody at the front line, and for my team, I know for sure everybody had volunteered to be here. And well, I don't know yet, but I'm sure our reward will certainly be coming. But it's just the same thing as working on the normal or the back line, or being a nurse on the ward. Yes, but it's certainly the same thing. We've all volunteers here.
All right. Thank you, Kobe. I'll come back to you. Let me come back to Dr. Jillian. Look, I'm enjoying your story so much. I think my eagerness is affecting your internet. So let me just keep a straight face. So far, you've told me about how you started treatment. You did supposed to treat, it didn't work, and then you were given some meds because your senior doctor calls and realizes you are not at work. So you take the treatment. But at this point, had you tested, or because you're a doctor, you knew?
No, but all this while, the case was still a suspected case of COVID, and then the patient sample was taken. So we're still waiting for the results of the patient. So all this while, we were still not having a confirmed case of a COVID-19 patient. So on the second, as I earlier on indicated, I had headaches adding on to my already existing dry cough temperature, and then the muscle weakness or muscle pains. So on the third, in the evening around 3, I'm called to the unit to see a patient. On arrival, I'm met with the news that the suspected case sample we took actually came back positive. So I went back again into the office, I changed, and then not telling anybody where I was going, why I didn't come again to see the patient. I just drove home, and that was how my own quarantine started in the house. So when I got home, I called my boss to find out whether he had heard of the news, but my boss did not pick, and it was later on I was told that he was actually in theater. Then I called my other colleagues also to find out how they were doing, and then if they heard of the news. They said they were still hanging on in there, but then yes, they heard the news. Then I make another call again to the hospital because I wanted to find out when our samples were going to be taken, because I'd already started exhibiting the signs of the COVID. So the person I actually called made me understand that the samples will be taken on a Monday, and then as for the symptoms I'm exhibiting, most probably it was my mind. So I should just be just be at peace with myself, and then just wait for the samples to be taken. It was a Friday, so I sat down and I'm thinking to myself, okay, so today is a Friday. I'm already exhibiting the signs of the disease, and then we're going to take our samples is going to be taken on a Monday. Okay, so I had no any other option but just to wait till the Monday. But just then I get a call. That was the following day, 4th. I get a call from one of my bosses I went under, who is now in Accra here, Dr. Apia Kubi, Dr. Kubi Apia Kubi, who called, and then he went like, Dr. Kubi. Then I remember my exact words I used. I said, boss, then I this time my cough was so bad, so he could hear me like cough excessively. And then the first thing he asked was how we were doing, and then whether our samples were being taken, and then if I actually got in contact with the patient. So all this was yes. And then he asked whether our samples were being taken. I said we are told our samples will be taken on Monday. So he made me understand that he wanted to connect me to our Assistant General Secretary, Dr. Titus Superior, to talk to me. So I said, okay. So just after I hung up, no, that was on the 5th, Dr. Titus called me. And then again, I was coughing. My cough was so bad that the thing was, each time I tried talking, then it aggregates the cough.
The cough.
So he asked whether our samples was taken again. I said, then our samples will be taken on the 6th. That was on a Monday. So he said, okay. Then I think he realized I actually needed some psychological support. So he also called Dr. Amma Edmonds to get in touch with me. So she actually called me and then tried to tell me to stay positive and then just to wait for the samples to be taken, and she kept on encouraging me.
Yeah, but just hold on. Being a doctor and going through those symptoms, I'm sure you knew, or how strongly did you suspect you had COVID based on all your knowledge as a doctor?
Okay, so the first sign I had was the high temperature, the bodily weakness, the fever, the chills. Okay. Then the next thing I had was a loss of smell. I had loss of smell on the 6th. So I was just about getting to that. So on the 6th, I was just about eating, and I realized that I couldn't smell the granite soup I was actually about to enjoy.
Wow.
So I stood up, I went to the washroom. I have this liquid soap, which has got this nice strawberry smell. Then I tried washing my hands again, and I couldn't smell anything. Then this time I become a bit alarmed. So I take my perfumes, I try to smell, I couldn't smell. I take body splash, I tried to smell, I couldn't smell anything. So I just sat on my bed and I was like, okay, what next? I think I have all the signs of the COVID. So just then again, Dr. Apia calls me. It's like, okay, how are you doing? Then I went like, boss, I think in addition to my symptoms, I have loss of smell. I can't smell anything. And then he went quiet for a while, for some seconds, and then he went like, so this is true. That was was just sleeping. So this
Wow.
is true. So I sat down and then I was thinking to myself, what is boss talking about and what is true? So he asked, are you able to breathe well? I said, yes, boss. And then he asked again, do you have any sore throat? I said, no, boss. Then he asked whether I had a pulse oximeter with me. I said, no, boss. So he actually advised that I get a pulse oximeter on me and then try to check my saturation and then make sure that in case of anything, I get the authorities. I call back again to the hospital and then let them know. So just then, my other boss, who happens to be at the regional health directorate, also calls me every now and then to find out how I was doing. So he also called and then I told him about my symptoms, and he also asked whether I could whether I could swallow. I said yes. And then he asked whether I was breathing very well. I said yes. And he also went further to ask whether I had any underlying conditions like maybe heart disease or maybe asthma, because I think he also realized that my cough was becoming serious rather than reducing. It was actually getting worse. So the problem I had with, or the torture I went through was to just wait for the results to be out. Okay, so on the 7th, on the 8th, on the 9th, my cough got worse. The surprising thing was that my temperature was normalized, and that was because I had started with azithromycin. I was on vitamin C. I've started with steam inhalation. A lot of my senior colleagues, my father-in-law asked me to start with steam inhalation. And then I was on zinc tablet. I even went a step further by taking cell GBT, like anything just to boost my immune system. I was taking a lot of fluids, and then I was taking tea with lime. Yes. So this was what I was doing. And then I was just very anxious, waiting for the results. So once a while I would call to find out whether they had heard anything concerning our results. And then when
did the results come?
Yes. So the results actually came a day before I was airlifted from the region. Wow. So on the 10th, I started desaturating. So I felt I couldn't breathe very well. And it was most probably because of the excessive cough. My cough was just too bad that I would cough for a very long time. But when I lay down quietly with the head poked up, I was able to, like without talking, then I would be able to most probably not cough for a while. But then when I start to talk, then the cough starts again. So my oxygen level started reducing on the 10th. And then, so when I checked my saturation, it was ranging between 65 to 70 room air. So this time around, my boss at the RHD calls me. And then this time I had sore throat also, mild sore throat, but I could swallow. So I called and then I told him that this was the symptoms I was now having. And then Dr. Titus was in the known, Dr. Ama Edwin was also in the known, and then Dr. Piakupi was also in the known. So my bosses actually advised that I move to the hospital because I was having sore throat and then all that. So my boss at the health directorate actually called me again before I left the house to the hospital. I actually drove myself to the hospital because I just didn't want anyone closer to me. I don't know, one way or the other, I was just positive that I was having the disease. I was just convinced. But the other problem I had was you being told that it's in your head, and I don't know why, but it was like it's not possible, but I felt I was actually having the COVID. So my sister who was with me by then even was like restricted from coming to my room. So everything she would bring would be at the door. I would go take it from there. And then when she was coming closer to the door, she would put on a mask and then all that. So I took my bag, and before I left the room, I get a call again. And then I was told that just to reassure me that my test result had come, and then it was negative. So this time around, again, I became so confused. Okay, so my test is negative. That is a good news. But then, what is all these symptoms I'm having? How do I explain these symptoms I'm having? So that was the other question I was also like thinking about. So I drove myself to the hospital. I was admitted at the female medical ward, and then immediately my saturation again was checked, and this time it was ranging between 75 to 80%, 75 to 85% room air. So before I was put on intranasal oxygen, I was nebulized and then put on intranasal oxygen. So on the 11th, around 4, I get a call from Dr. Anthony Isiatsari, who tried to find out how I was doing. But because my cough was so bad, all what I could manage to tell him was that my results was in and it was negative. So I was being managed now for upper respiratory tract infection. And then, so all what I could hear him also say was, yes, I think your results, your test, your sample would have to be taken again, and then get ready. You will be airlifted to Accra for further management. So get your whoever relative is going to accompany you, and then you'll be airlifted.
I'll hold a story here. I'll take a short break, and then when we come back, you will tell us what happened afterwards, because we actually are told that her condition got very serious before she recovered. But tonight we have two doctors. One had COVID, went through the condition, she's recovered. The other has been looking after COVID patients at the Ga East Medical Center. We have a nurse and a health blogger, Kobe Blay, and we have a gentleman who had mild symptoms of COVID. It was positive. I don't believe it was that mild, but his doctor says it was very mild, James. So when we come back, we'll wrap up the story from Dr. Buji and also take some of your comments. This is the point of view. Stay with us. Welcome back. Thank you for staying with us. This is the point of view. Tonight we're hearing two stories, two very different stories. One was mild, that's James. The other was pretty serious. She hasn't even gotten to the place where she got into ICU yet. One is an ordinary person like me, non-doctor. The other is a doctor. One was treated at Ga East, the other, I think, at Kolebu. Both are alive, and we thank God for that. We also have a doctor and a nurse, Dr. Joseph Oliver Comey, member of the COVID-19 case management. He is one of the guys at the Ga East. And of course, Kobe Blay, a nurse and a health blogger. He's at Kolebu. I also have Dr. Jillian Buchi. Doc, so thank you so much for staying. I just wanted you to speed up the story for me. So Insiasa recalls you. He says they'll take another sample. They say you are negative, yet you have all the symptoms, and you're a doctor, so you sort of suspect you have COVID. Just run me through how you actually got the positive test result and how far you got into COVID before you recovered.
Okay. So I was airlifted to Accra, and I was sent straight to the medical ICU. So there, some samples were taken, so blood samples were taken. I had a whole lot of investigations going on in there. They had carried out a lot of investigations on me. And then among the investigations they took again was to take the sample again for COVID-19. So in, I think in 3 to 4 days, the results comes in, and then I'm told it's positive. So the management continued actually. So I was moved from the medical ICU to reverse unit. But then they had a little bit of a challenge trying to suppress my cough. So because of that, I had to go on a whole lot of medications. And at the point in time, I had panic attacks, and then I had to be put on antidepressants and then stuff like that. At a certain point in time, I had my BP shooting. At a certain point in time, I had my BP dropping. So they actually went through thick and thin just to get me where I am.
So how many days between when you noticed symptoms to when you actually recovered? How many days are we talking about?
It took me 1 month and 3 days. So I started having the symptoms on the 31st, and I was discharged from the unit on the 2nd of May. So I spent 8 days in the ICU, and then I spent 12 days at the unit, and then the remaining weeks I spent.
Okay. Let me come to Dr. Joseph, but thank you for sharing. I'll come back to you. Dr. Joseph, so you have somebody who did less than, somebody was mild, that's James, very few days, home management, And then here you have a doctor, 1 month and 2 days or 3 days, went into medical ICU. So how do we describe her? Is she mild? Is she moderate? Is she, what is she in the scale, on the scale?
She is severe.
Severe?
Yes. Once your oxygen saturation goes below 94, even without symptoms, we'll say you are severe. Because we've noticed that in COVID, there's what they call the silent hypoxia. That kills a lot of people suddenly. So yes, James was mild, but then my colleague was severe.
So if somebody is severe, it means what? They are very sick and that they can die? Is that what it means?
So like we said, we've been saying there's a whole range. We have asymptomatic, they don't have symptoms. Then we have the mild. The mild group tend to have maybe just a cough, maybe just bodily aches, just like my colleague had. And then you have the moderates. The moderates tend to have what we call lower respiratory tract symptoms. They are coughing, they are bringing out some form of phlegm, okay? And then the severe ones tend to have oxygen saturation dropping to about 94, and they may need some level of oxygenation. So you give them oxygen either by face mask or by nasal prongs. Then we have the critical. The critical people need maybe ventilatory support to keep alive. So when we say you're severe, you need extra oxygen to be able to carry out your normal form of breathing.
So what determines whether somebody's COVID is mild, moderate, or severe? Is it their underlying condition or the place they got the virus from, or what? Why did James have mild and Doc have severe?
So sometimes it depends also on the infective load of the virus. Okay, so if you have a high infective load, you may have what do you call a milder or a moderate form of the disease. It also depends on your immune system. Some of us have very good immune system. That's how come some people are infected, yet they do not have any symptoms. Mind you, COVID-19 is a disease that is not known. We are still learning about COVID-19. Why should somebody walk around asymptomatic? No, but when you check the oxygen saturation, 74. And at that point, that person is no longer considered asymptomatic, but severe. So we really cannot explain everything, what really happens to the individual. But some are severe, some are asymptomatic, some are mild. But we think that sometimes your body's immune system and how your body responds to infection will also account for that.
I see. So, Kobe, I am guessing Dr. Jillian was at Kolebu. Is that where she was? Hello, Kobe. Kobe.
Hello.
Yes.
Yeah.
Yes. So Dr. Jillian was at the Kolebu treatment center, right?
I think she mentioned that earlier. Yeah.
So, what were you people doing for your patients? What were you giving them? And were you also, what type of help? Were you praying for them? Were you giving them psychological help? I mean, what were you doing for them while they were there?
I think basically what happened is what we call the case management. And in case management, it's sort of a multidisciplinary approach. You respond to a patient's situation based on the symptoms the person is exhibiting. So if there is fever, if there is cough, you provide appropriate treatment as much as possible. And this is managed by a team. So you have the nurses with the doctors, you have the environmentalists, you even have hygienists, you have the laundry, you have the nutritionist, you have physiotherapists, which all of these people are coordinated by the nurses. So including the psychologist. So the nurse has to be able to observe the patient's situation and be able to communicate with all these team and be able to respond appropriately as possible. So if a patient is having issues of anxiety because there are people who are in isolation and taking treatment, and are anxious about the outcomes, are anxious about what will happen to them, and you definitely have to engage them in what we call psychotherapy. If you realize also that the nutritional intake of this person is also imbalanced in a way that he's not taking much food, and that could directly affect the immunity, you need to involve the nutritionist, and as per the menu, you provide patients with the food that would help the person boost the immunity. And you equally have to engage them in some sort of physical activities so that to keep them active rather than being in bed all day. And this is done through a multidisciplinary approach, coordinated wholly by the...
Okay, let me come back to James. So James, you are the one who was allegedly mild. You were managed from home. Do you know where you got COVID? Have you sort of, did you do that calculation when you were told? Did you? Yeah.
It is tough to say. And before I go on, very quickly, Dr. Jillian, God bless you. I just want to commend your resilience, because I can't imagine what you went through. What you went through was much tougher. So I just want to pass that comment. But on my end, with respect to tracing, it was very hard because I hadn't really done much that week. On Friday evening, before the Monday when I started feeling symptoms, that Friday, I had been out a little bit in town. I imagined I saw different people from different places, so it was possible that it was on. So that Friday, and mind you, all the people I saw Saturday, Sunday, when they all got checked, I was very, very interactive with these people. Nobody had COVID, so it's very, very tricky to say. I've been trying to put a finger on it, but at some point I just had to let that go. I just had to let that go and be thankful that all the people that had been checked didn't have it.
So yours was described as home management. So how did you work that out? Because I'm sure you have family. How did they administer the treatment? What did your friends and family think whilst you were home? How were you social distancing and all of those things? James, are you there? Okay. For some reason, we're having some challenge with...
Okay, I'm with you. Yeah, okay.
Yes.
Question. But really, I was one of the earlier cases. So the first reported cases from the embassy, I think it was the Norwegian embassy, that was on Thursday. And on Monday, my symptoms had come up.
Wow.
At that stage, fortunately for me, the craziness of COVID had not yet been described in that sense. The death rates weren't as high, with the exception of in Italy. And so I was a little calmer because they were saying young people were stronger. So that kept me at bay. I had some people that knew people that had gone through it around our age, and they had told me that, they had recovered, they had gone through it, so I shouldn't stress. So that sort of kept me calm. Being at home, I was with my mom and with my cousin. I was very concerned for my mom because she's a little older, and that was my biggest worry. So as soon as I found out, for 30 days, I stayed in my bedroom for 30 days, in my room.
Wow.
Every day, I took 1 hour. She would open all the doors in the house. I'll put on a mask. She would go to her room with her mask on, but she would go to her room. She would call me and tell me the doors are open. I'll go outside with a foldable chair, dump my trash in the bin, which is disposable plates I'd eaten with, disposable cups. And I'll sit outside for an hour, or I'll take a walk outside for an hour. Then I come back to the room every day for 1 hour. We did that for 30 days. And she was clear. She never had it because we were very strict about that regimen, until recovery.
Wow. Let me do a quick one to Doc Oliver, then I'll come to Dr. Jillian. So Doc, what treatment do you give COVID patients? Does it depend on their severity? Because I've heard different things. I've heard something steam bath, I've heard some antibiotic, I've heard chloroquine and all kinds of things. What do you give them?
The key thing is that as of now, nobody knows the right treatment for COVID. Having said that, there are some molecules that we use. We'll either use hydroxychloroquine, or if we don't have hydroxychloroquine, we may use chloroquine. In Ghana, we are using azithromycin also. We are giving vitamin C. We are giving zinc. In other places, they are using some antiretrovirals like lopinavir and then remdesivir. But for our country, the molecules we have in country is azithromycin, chloroquine, and hydroxychloroquine. Per our guidelines, it said that for anybody who is asymptomatic, you may either decide to do hydroxychloroquine alone or chloroquine alone. If the person has mild to moderate disease, then you want to do a combination of either hydroxychloroquine with azithromycin or chloroquine with azithromycin or another drug called doxycycline. And if the patient is quite severe, so you move from the mild, moderate, and now you are severe. At severe, you may want to add on to your hydroxychloroquine, your azithromycin. You want to try other new molecules like the remdesivir, if it's available in the country. I must say that for now, we're just using the hydroxychloroquine, chloroquine, and azithromycin.
Good.
Mind you, there are some people who are not taking anything. They have refused to take any medication, but their immune systems have kept them going and they have recovered.
Wow.
And
okay, the 29 who have unfortunately passed, when we see the list, only 3 or so had no underlying conditions. Again, a lot of the underlying conditions appear to be hypertension, diabetes type of thing. What's going on there, and how come they are dying? Is it that we are only treating for COVID and we are not treating the underlying conditions, or we don't see the underlying conditions early? How come all these people are dying?
well, I must say that when you have certain comorbid conditions, it increases your risk of dying from COVID. So what happens is that you get COVID, and then COVID aggravates your other conditions. So the management of your other conditions may become a little more difficult, and then you may succumb to the disease. So you may die actually from the complications of your other diseases and not necessarily from COVID. Or COVID could just aggravate your other conditions, and together you succumb. I must say that for some of the cases, actually, I tend to know about the cases. Some people died within 2 days of having presented to the hospital. Some were diagnosed in the community. They didn't turn up in the hospitals, appeared in the hospitals, and within 48 hours, they had passed on. Some passed on, and we find out that when the results come back, they were positive for COVID. And so even worldwide, those with underlying conditions, pre-morbid conditions, increases your risk of dying from COVID or having a more severe form of COVID.
Okay, Dr. Jillian, let's just come back to you and what you went through. Look, I want to thank you for talking, because it's not been easy getting people to share their stories. And now you being a doctor, I mean, I find that very weird. So is it that do you feel you got it in the line of duty, and how come you are not bitter and you are rather talking? Because for somebody who is working as a doctor to get COVID and now make yourself an advocate, you just walk me through your thinking process, talking to the world, showing your face on TV, educating people, and all of this.
So when I started researching, so many things were running through my mind. So what I actually decided to do was to write down this content for my family, because this time around I was slowly giving up, and then I felt I wouldn't be able to make it. So I was making videos of myself and how I was feeling, and then writing down messages for my family, for my loved ones, for friends, and then God. And then I also realized that there's a lot of misinformation about this COVID-19 going on. So I decided, and then I told myself that if by God's grace I pull through, I think I would be an advocate to help in the stigmatization of patients who are recovered from COVID, and then to help in the advocacy. So I actually started having this, and then I I just told myself, if I'm able to pull through this, then I think I would have to come out and then be an advocate. Let the world know, or let the public know, that once you have recovered from COVID, you are recovered, okay? Catching COVID or getting down with COVID doesn't mean that you are going to have it for the rest of your life. And I also felt very bad the way people who had, or patients who had recovered from COVID were being stigmatized to the extent of even throwing, like stoning them and then all that. It really touched me, and I decided to come out and then like help in that advocacy and then help reduce the stigmatization which is surrounding this COVID-19 disease.
But based on what you know in the regions, I mean, what can you say about giving health workers PPEs and those kinds of things? How helpful would they be? Because I'm sure some would ask whether at the time you got it, you were even in your PPE at all. You get my point. So what can you say about PPEs working in, you were not in Accra, so I'm guessing facilities were not as solid as they are in Accra. What can you say about that?
Well, it's a very difficult one to answer, and what I would say is that I would just plead with the general public that when they are donating to the various hospitals, let's take PPEs and then all the personal protective equipment, they should remember the North as well, because all along, what I kept on hearing was donation to this hospital, and all was in the South. Very few NGOs, very few persons went down to the North to do the donation. Yes, you are very right. We are actually having challenges with this personal protective equipment, and just like you rightly said, yes, I was not actually protected, yes. So that's just my humble plea, that when we are donating to other hospitals, please let's try and then get closer to the North as well. And then I will just thank those who have already donated some PPEs to the 3 northern regions, and we would ask that, just like Oliver Twist, we're asking for more.
Let me read a few comments and then I'll take final reactions from everybody. Good evening, Bernard. This is our respected doctor at Lekma Hospital, Dr. Kome. Lekma staff supports your good works. This is favored from Teshi. Bernard, these stories cannot be treated as whimsical. May politics not becloud our sense of sensibility towards this pandemic. Albert Kisi, Santa Maria. Good evening, Bernard. It's good recovered persons have come out to share their stories, as well as my colleague health professionals amid all these. Our 50% has not been paid, but it shall be well. And this is from Koforidia. All right, let me sort of try and work my way around to wrap up. Let me start with Kobe. So, as a nurse on the front line, what's the most important thing we should know about COVID in Ghana? It seems as if the messages are mixed. So, what's the most critical thing you think the general public needs to know about COVID? Kobe.
Just before that, what is critical and central, I mean, in the clinic area, in providing all this care, which we already do, is the infection prevention control. That is the IPC measures that is taken in the hospital, which includes the hand washing, the foot bathing, the wearing of appropriate PPEs, and the cleaning of the environment, ensuring the environment clean. This is very central to the outcomes of the treatment in the clinic area. But then again, when you come to the public, these infection prevention controls come in different forms, like the social distancing, the hand washing, the use of face masks, the not touching of face, not coming into contact with people who are sick, or making sure that people who feel sick isolate and report themselves as soon as possible. For now, for where we are, you must treat even your partner as a suspected person or person who could be positive, because we barely can tell who may have it or who may not have it.
Thank you, Kobe. Dr. Oliver Kome, 2 quick things. At your place at Ga East, how many people have gone through the place and how many have recovered? Do you have those figures at the top of your mind?
Currently, we have about 293 patients on admission, and I can say that 224 have recovered and gone home.
Wow. 219
293 on admission who have gone
293.
through the state, and 224 have recovered.
Amazing. What percentage were critical? Do you know?
We've just had about 6 or so critical cases out of this 293.
And are you the largest COVID treatment center in Ghana?
If you consider the PCC, that's the Pentecost Center, they have over 500 patients. We have 293 so far, but they have 500 patients. So I'll say the PCC, even though it's not a hospital, has the largest numbers of COVID positive patients. But maybe just to say that we also need to make sure that at least the people, everybody has been giving credit to doctors, but please let's also give credit to the National Ambulance Service, the EMT guys over there. They have been wonderful. Had it not been for them, some people will never reach the hospital and some people would have lost their lives.
Super. James, are you back working? Are you reintegrated, or you are just taking it cool since COVID? What are you up to now?
A bit of both. I mean, still, it's still out there. They talk about antibodies, but I'm still being careful. But I've re-engaged. I'm still going to work as and when I have to. And life has been all right. My friends have been okay. They haven't stigmatized too much, thankfully, because they understood that we went through the process and I'm clear and I wouldn't put them at risk. So fortunately, they've been good. My mother has been fantastic. She's been supportive as well. So thankfully, it has been all right for me. By God's grace,
Okay,
it's been all right.
thank you. Dr. Buji, you have the final word. Are you back on ward rounds, or you're still, what are you doing? Doc, did you hear my question? I can't hear your answer.
No. I'm still in Accra. I've still not gone to the north yet.
Will you go back?
Of course.
Okay, then I wish you well when you go back. Thank you for sharing your story.
Okay, you're welcome.
Thank you. We've been speaking to Dr. Jillian Buji. She's a medical practitioner recovering from COVID-19. She had it for 1 month, 3 days. James recovered from COVID-19. He had a mild case. Doc's one was pretty serious. She even went into medical ICU. James, it's described as mild, but I think it was pretty serious. I mean, he had to be given a lot of medicine. He got it at the earlier part, and he's jovial now. Dr. Joseph Oliver Comey is a member of the COVID-19 case management team, an infectious disease physician at Ghana East, and they've had almost 600 patients pass through their hands. 224 still there, 293. 224 recovered, 293 still there. Kobe Blay, a nurse and a health blogger, Kolebu Teaching Hospital on the front lines. My name is Ben Able. Thank you for watching. Pardon us for some of the technical hitches. Great to connect with all of you. Stay safe, stay well, and we'll defeat COVID-19 together. We'll see you next time. Bye-bye.